So I'm here today, County Superintendent of Schools, Nancy McGee, to introduce our amazing SMCOE COVID-19 response team, Executive Director Patricia Love, and our beloved nurse Jill, who's serving the county this year from the County Office of Education. And as many of you know, I also want to just say thank you to all of you for everything you're doing every single day. I mean, I know everybody's just working around the clock. And the reason for this training is because the more students you bring on campus and the more staff who come on campus and people are getting their curative testing or whatever staff testing you're doing rolling, then it's sort of a 2-for-1. You test and then you get to contact trace. So for us at the County Office of Ed, we're often getting our testing results on Saturday morning. So guess how we're spending our weekends? That was a little bit of a surprise, but anyway, we recognize that it can be really complicated. It's sensitive information. The better you handle this and communicate positively and proactively with your community, the more you reinforce the culture of safety that we're working really hard to build. And the other piece that I would say is that this isn't going away. We're only going to be doing this more and more. Even though we've got 2021 is 20 days away, and I'm counting. Anybody who's heard from me this week has heard me do the countdown to 2021. But even though we have a vaccine and 2021 is going to be much brighter, much more hopeful, but it does not mean that COVID-19 is going to completely disappear from our communities, and we are going to continue to have to manage safe practices as we go. So I believe that staff and student testing, we haven't even really ramped up student testing yet. And we're not even sure what that kind of contact tracing is going to involve. But right now, we're mostly looking at staff contact tracing. It's not going to go away in 2021. So it's best to get your systems in place, invest time, train up, develop your sort of cohort of like-minded folks who are doing the same work so you can lean in and ask questions. I also wanted to, I see that Jill, you reached out to Leanne Leanne, I think you're here from the Menlo Park City School District operating as their school nurse. And we're happy to have you. I know you're potentially going to add value to our conversations and our training down the road, but today is just sort of an introduction. But I'd like just to welcome you and thank you for attending today. Okay, so I think what we're going to do is Nurse Jill is going to really be paying attention to your chat questions. And so if you have questions, please put them in the chat. She'll be responding. We can also stop and answer questions if you have, put your hands up and things like that. I see Valerie just put her hand up, but Patricia, you had a comment?
We were using the Q&A.
Oh, my bad.
We can use the chat. It doesn't matter. We just didn't want to use two.
No, we'll use the Q&A. Nobody, I'm always like a few steps behind on this, that you guys know that working with your superintendents, that they never really know what's going on in the moment, just in the big picture. So here we go, Q&A. Definitely tune into that. And Valerie, that's probably why you were raising your hand, to put us back on the same page. Am I right? Okay. All right, so I'm going to kick it over to Patricia, and off we go. Contact tracing for schools.
Thank you, Nancy. Thanks, Jill, for being here. I'm Patricia Love, Executive Director of Strategy and Communications, and mostly on the COVID-19 response team at the county office. So this is the first time we've done a training on contact tracing outside of our organization. So you can certainly give us all of your feedback after after this is over, and hopefully we will get through the content because we have a lot. And I think Jill has shared, put together the slides and some other information in a folder that you can link to in the chat at some point. Okay, so our agenda basically for today is we're going to kind of give some context, give some definitions that are really important to use in contact tracing, and then kind of go through some basic steps, what an interview might look like, and then some tips at the end, and then have some time, we hope, for your questions. And then meanwhile, if you have any questions, just please add them to the chat and, or excuse me, the Q&A, and Jill is going to work on answering them, maybe Superintendent McGee as well, if they're kind of policy things. So I wanted to start where everything starts, and that's the Pandemic Recovery Framework. That is the document that has guided our work for months and months. Every plan in San Mateo County, every school reopening plan is based on the Pandemic Recovery Framework. It is something that if you are a contact tracer, you should be pretty familiar with. Currently, pages 40 to 48 have contact tracing information in them. You should be familiar with that. I do want to say that we are working on another revision. I don't know how much the contact tracing part would change. I don't think at all, but there are a few things that will change, and we will have a little guide at the beginning to say what those are. Again, grounded in science, regularly updated, and the key thing with the Pandemic Recovery Framework is that it just includes layers and layers of various protections, and one of those is contact tracing. So what is contact tracing? We'll just kind of start here at the beginning. Process of identifying people, in this case, who have COVID, who have been exposed to people with COVID-19. And we're going to go through a bunch of definitions. And so the whole key, though, is to take a case and find out who that person might have been with and identify close contacts. That's the basic thing. So there's different parts, and a lot of the things I'm going to mention are based on questions that we get. So schools contact trace within their school or their district setting. San Mateo County Health contact traces outside of the school setting and supports schools. So if you're in a school, you don't need to do contact tracing with who Mr. Jones was with over the weekend, or who a child was with, trying to figure that out. That's the job of San Mateo County Health. Yours is figuring out who the close contacts are within your school. So I want to spend some time on some definitions. These are really critical, and I apologize if you know these really well, but we really can't have a conversation without going over these definitions. So a case is simply a person who tests positive for COVID-19. That's it. That's what a case is. I'm not going to get into probable cases until later, but right now we're just going to focus on a case. That's a person who took a test and is positive for COVID-19. Close contact is a person who is within 6 feet of a confirmed case for more than 15 minutes over a 24-hour period, regardless of face covering use. So that definition has been tweaked a little bit, because it used to be 15 minutes, we'd say, but it was always over a 24-hour period. So that's why it's a little trickier, because we have to know like 5 minutes here and 5 minutes here and 5 minutes here over the course of the day. And then an indirect contact is a person who may have been in proximity to a close contact. We are all close. We are all indirect contacts. So we are not going to focus on indirect contacts. There's, like I said, that's pretty much the population at large right now. So just cases and close contacts. So there's a
before we go on, I think it's really a good point to add that you know that the cases are really spiking in San Mateo County and across the state. And so the advice that I heard on a county call this morning from the chief health officer, Louise Rogers, is that we should all be treating each other as if we are asymptomatic positive. So every single person you see in your work environment, in your social environment, and your home environment, you should assume that people are carrying the virus as asymptomatic carriers, and therefore implementing all the safeguards that you can possibly make sense in whatever the setting is that you're in. So I just wanted to add that in right at that moment before we head into the rest of this.
That's great, Nancy, because that's pretty key to all of this, especially right now. So I wanted to go on to terms, and again, Nancy, Jill, jump in at any point. This is an area that we get a lot of questions about, and this is the exposure period, and it is a key element of contact tracing. You have to understand what the exposure period is in order to do contact tracing. You need to determine the exposure period to identify the close contacts. And so here's the definition. Cases are considered infectious starting 48 hours before developing symptoms, or for asymptomatic cases, 48 hours prior to the date of the positive test. So it's 48 hours prior to the date of the test, not the result. That's a one we get a lot of questions about. So you may take a test on a Thursday and you got the results on the next Wednesday. We're really going back to Thursday. So all the counting, everything goes back to the date of that test, not when the result comes back in the asymptomatic cases. Okay, so other terms to use, there's always some confusion about isolation versus quarantine. So cases are required to isolate. That requires the case separating entirely from all others, including people in their household who do not have COVID-19. And you need to stay home, it goes without saying, until it's safe to be with other people. And you might set up a separate room in your house to do that, different meals, different bathrooms and such. So quarantine, this is much more common. Close contacts are required to quarantine. Close contacts should remain separated from others, and this just interrupts the disease transmission. So you should stay home and quarantine until it's safe for others around you. And so you will know because someone will tell you what your quarantine period is.
And again, Patricia, new guidance that's coming from public health right now is if you have someone in your household that is identified as a close contact, their public health is recommending mask wearing inside the home. And that's new. That's only if someone has been potentially exposed. And then the other mask wearing inside spaces is if you're in someone else's home in some kind of social interaction outside of your social bubble, there's a new recommendation that we're masking inside people's houses when you go somewhere else outside your own house.
And that reminds me, thank you, that there's a lot of confusion because the CDC came out and said that quarantine could be shortened to 7 days. Some people said 10 days, but we checked with San Mateo County Health and they are still going with the 14-day quarantine process timeframe. So you may hear something that we've moved to a shorter quarantine timeframe, but according to San Mateo County Health, we have not. Doesn't mean we won't switch to that, but right now we're still in the 14-day. So I wanted to also talk a little bit about screening and contact tracing. I think when you lump these things together, even though you might be the person doing both of them, it feels very overwhelming. And so today we're really talking about the contact tracing part of this. So screening is this process where you self-screen at home. How do I feel? Do I feel strange? Do I have a fever? The screening questions that you'll be asked when you get to work or you'll use on an app at home. Any site-based screening, for example, with children and such, you might be kind of monitoring how do they look throughout the course of the day. That's all screening. And that's not really part of contact tracing, but it can lead to it. So you might identify people and take steps that will lead to contact tracing, but generally we're not going to really be focusing on that. If you have questions that are about screening, you can put them in the chat. And we're fortunate to have Nurse Jill with us so she can answer some of those, because I know that that is an area where a lot of people have questions. And I have this little picture here, and that is hopefully familiar to all of you if you are working in a school doing contact tracing or screening. And that's the screening questionnaire that San Mateo County Health would like us to use, those questions. And when you use those, that's how they can potentially identify a case. And so contact tracing, steps we take when there's a confirmed case. So the other thing I want to talk about is the link between testing and contact tracing. And Nancy, please jump in here at any point. Testing is clearly linked to contact tracing, as Nancy said. More testing means greater identification of cases. So if you're a contact tracer, you're going to get a lot busier if your school starts upping up the testing, which also the flip side means these cases have been around us, and in our schools and other places, we just weren't aware of it until we started doing the testing. And a smooth process reinforces a sense of safety. So that's really important, that kind of how these are linked. And the more you do all of this testing, contact tracing, the easier it gets. Same with the screening. So if you're in a school that hasn't really brought people back, it sounds really overwhelming right now, but we have plenty of people on this call who have been doing this for months and can potentially share some of their thoughts on that. Oops. Don't want that. Okay, so I wanted to just add, so Nancy actually gave us even more recent information from San Mateo County Health, which I hadn't even heard, which was very interesting. Have to process that a little bit. But I think the most important piece on here is that more than 50% of transmission occurs from asymptomatic or pre-symptomatic people. And that's why we do the testing, simply. This is where it's happening, and so we need to do the testing. The other ones are sort of more obvious. So I want to transition now to talking about setting up contact tracing. Nancy or Jill, did you have anything on what I discussed that you want to add? Okay. So if you don't have a plan for contact tracing now, we're going to go over a few things that you should think about as you set up your contact tracing program for your school. First, you're going to want to identify a school site COVID-19 point person as a contact tracer. That's going to be critical. You need to have a clear person identified to do this type of work. You also will want to have redundancy, have other people lined up to do this work. So you want to pick a person who is discreet, understands protecting confidentiality. It's a huge responsibility, and you need somebody who can do this job discreetly. This person will need to have access to the testing data. So whoever has your testing data, maybe it will be the same person. Person's going to need access to that. That's critical. They'll need access to employee contact information. So as Nancy mentioned, we've been doing contact tracing on the weekend a lot. And so we needed to change how we had access to that kind of information. It's going to take time. So if somebody already has a really big job, they're going to have to lose some other tasks on their schedule to do this job, because it can take a lot of time. And it may involve weekends, evenings. And the other piece is that as you pick this person, they're going to need to have some access to human resources, either because they already are in human resources, to answer questions, because these questions sometimes you get when you're doing cases with school staff are kind of tricky about what leave do I take and how does this work and when do I come back. So sometimes that's really helpful to have human resources involved. You also will need to a documented process. So you want to figure out the steps, and we're going to go through some of these, like when we learn of a case, what do we do? What first? What do we do second? What do we do third? Have that be very clear. Have all the people who are in that plan know what the plan is. Have a data tracking system. This can be a simple spreadsheet, but when you get a case, you're going to want to make sure that the contact tracer person in particular, know who they are, when they came in, when they can come back to school, when they can come back to work. All these different pieces are going to be important to keep track of all those dates, because is it a 10-day isolation period? Is it a 14-day quarantine process? So you want to be able to have a good system in place and do this before you need to do it. And you're probably, the key thing here also is you're going to tweak your process as you go. You're going to learn, oh, that didn't really work, so we're going to adjust it. But it's good to try to set up and answer these things before you start.
And Patricia, I want to add, because there's a question in the Q&A about length of time that the test results take to get back. So over the last, when we first all started kind of testing, things were moving pretty quickly. Over the last few weeks, you might have noticed that your testing results are slowing down. Um, Twice a month, I'm on the phone with the Bay Area health officers, and I ask this question about what we can anticipate for um, whether the testing across the state is getting saturated and overwhelmed. And they did acknowledge that, yes, it's slowing down everywhere in every system. And we can probably anticipate that that will continue. Um, Perhaps not to the degree that you might have, experienced to date. It might, they might continue to put resources in, but this is an imperfect system. Like all we can do, we rely on other systems. So all we can do is do the best we can with the information that we have and use our common sense to kind of do this as well. I'm just acknowledging that, yes, the testing is starting to slow down between test date and results. Probably going to continue through the holidays that way.
So I want to just go back to what we talked about before, layers of safety. So contact tracing is just one layer of safety. We are assuming, the reason we have all these layers is we are assuming we are working with and teaching and involved with people who actually have COVID-19. That's why we wear face covering. If we knew no one had it, we wouldn't wear face coverings and we wouldn't do physical distancing. So yes, the testing results may take a little bit of time to get back. We have these other measures in place. If we're following them closely, then we should be okay. The other piece is, and this I can't emphasize enough, is the cohorting. Keep true to those cohorts that you have, and your contact tracing is so much easier, and the impact of somebody who potentially has COVID is minimized. So I talked to one school and they were doing great with cohorting, and then they just thought all the kids should get together and have recess together because they're little and that would be really fun, and they have their face coverings on. So they just took out 2 or 3 kindergarten classes because they did that. So it's just really important to try to keep the kids in the cohort, keep the teachers in their classrooms. A lot of spread happens when people eat. So if you're avoiding having people sitting with their face coverings off within 6 feet of each other, that can make a big difference. So
and Patricia, when you say they knocked out those 2 kindergarten classes or whatever, you're talking about because there was a positive case and then the cohorts had to go home for 14 days.
That's right. There was a positive case, and it was like, I think, a decision they made, and they made it kind of knowing it was risky. And then they had a positive case, and so they had to send everybody home.
Right. And so that is when you get back in school and people start to get comfortable, like, oh, we're doing great, coming to school every day, then you can't let your guard down. And we're not going to be able to do that for quite a while, definitely the rest of this school year. So the 4 pillars are essential all the time, every day. And if you're a school leader, you have to keep reminding people about the protocols and what the expectations are.
Right. So I'm going to keep going on. So you'll want to have a way to share, a confidential way to share information. Phone is often a really good way to do that. You don't want to be putting people's names into emails and sharing those all around, especially since they could be forwarded. You're going to want a questionnaire or some kind of survey tool to use. Have that in advance. Jill put one in the shared file folder. You can use that, adjust it as you wish. It's just one sample. You need to come up with what makes sense for your schools. You'll need to make sure that HR and district support is ready. You'll want backup contact tracers. You'll want to have a communication plan and templates, and we'll talk about some of these things. But these, it's December and you're not coming back sometime in January, you can start working on all these things now. So now I'm going to go through some contact tracing steps, and these are kind of an overview, though they still feel like a lot of information, and you have all these slides, so you can take notes and of course reach out to us later. So the first thing that happens in contact tracing is that there's a notification of a case. And you might get that through your testing provider. We have one person who gets our results through Curative. And so that's how we get some of our information at the County Office of Education. There might be a direct report to the COVID-19 school point person, your contact tracer. It's good to let everybody know that's who they should reach out to if you have questions, or if you find that you're a case, reach out to that person. And so everybody knows. Notification of a supervisor is another way that this could happen, and then through a screening process. And the screening process is a little more complicated, and I'm not going to really get into that, but if you find that somebody has symptoms that hit the San Mateo County's health bar on a couple levels, and you're not really sure what to do, you wouldn't send anybody home, and they haven't, and the person refuses to get tested or can't get tested, you're not going to automatically shut down a cohort. You're going to call San Mateo County Health, and you're going to tell them the situation, and they will walk you through the process to let you know if it's warranted to close a cohort. So that is not that common. Quite often, people have symptoms, you just leave them home, and the cohort is not impacted. But I know that's kind of it sounds like that's going to be a big, scary kind of thing, but there is support for that. The other thing on the notification of a case is it would be helpful when you're talking to your school community, parents or teachers, is that they really let this point person know, or a supervisor know, or principal know when they are a case, and they don't go and tell everybody who they think should know, because I'm just helping them out because I wanted them to know that they might be a case. I didn't know how long you were going to get to them. Because that just puts fear into people, and it's unnecessary. And so really encourage people to use the communication channels that you've set up. And quite often that's a point person or a supervisor who they're going to report to. More steps. So you will then, the contact tracer that is, will call the case, and you wouldn't do this online. You should call the person and have a conversation with them, conduct an interview. And first thing is to confirm that they are indeed a case. Sometimes people will say, I didn't know I was a case, they weren't aware of it, or I don't know how you got that information. Sometimes there's misinformation, believe it or not. Express concern. I think that's sad that I have to say it, but it's an important piece. And then let them know that they should contact their medical provider for care as soon as possible. That's not your role, but you should just confirm that they know they should be doing that. And then ask them the questions listed on your contact tracing questionnaire, go through them. Be sure to go through the entire day and take notes on issues that may need more attention. Like, I'm not really sure about that, because when you go and talk to San Mateo County Health later on, you can ask them some of these questions and they'll help you out. Like, if you're not really sure, did that constitute as a close contact? I'm not really sure. San Mateo County Health can help you. You can also contact us, but for medical advice or assistance, you really should reach out to San Mateo County Health. So we have this survey, and I'm just going to go through these kind of quickly just to give you a flavor of what kinds of questions are in the contact tracing survey. You're going to need to collect some basic background information. You'll need that for San Mateo County Health. They're going to ask you these questions, so you're going to want to make sure you jot down this information. You'll want to know things about, like, were you present on a school or district site during the 2 weeks before you tested positive? And when were you last on your work site? So those two questions are really important to this for different reasons. The first one, if somebody was present on your school site for the last 2 weeks, they potentially can ask for workers' compensation. And there's a whole bunch of legal things and HR things that you would really want to talk to your HR people about. But it's important for you to kind of document if they say they were. It's also important for you to kind of understand, maybe if they say, well, my husband had it or something else, okay, that's a useful piece of information. These are things you will want to know later on. And then you'll want to ask about when they were last on their work site. So if this case hasn't been on the school site for 48 hours prior to the test being taken, or the onset of symptoms, then done. That was great. Thank you so much. We'll get to what you talked to them about later, but there's no need to do contact tracing. And this is quite often the answer that we have, that the person hasn't, like right now, hasn't been on campus or hasn't been um, on any of our school sites. Interview questions for the case. So here we go. Then identifying the close contacts. So this is an important part that I sometimes think gets overlooked, and that is going through all the days that work beginning 24 hours. Okay, this is a little different. Before you took the test, if applicable, or when you started experiencing symptoms, and then go through their days they were on campus. So if they got a positive result, or that when they took the test on a Friday, we need to go back to Wednesday, and they need to kind of go through with you step by step through their day. Like when you arrived at campus, what did you do? Who do you interact with? All that type of thing. And if you're in a classroom that there might be specialists coming in, you want to make sure that somebody like the teacher is kind of keeping track of who's coming in and out of their classroom. And if there are people that don't really need to be there, an administrator or something, that often you want to make sure that that is kept to a minimum, so we don't end up taking out a whole classroom because somebody was in there a lot talking to them and they ended up having COVID. So that's going to be really important in going through their whole list of people. So anyway, if there's anybody, yes, these are possible close contacts. They're not necessarily close contacts. It just gives you some place to start looking. So list their names in the field below, separated. Okay, well, we didn't edit that out. And did you spend more than 15 minutes with anyone over the course of the workday? So this could be at lunch, this could be out at recess, this could be at the end of the day. And then when either of you are wearing a face cover, yes or no. And if it's yes, now we've identified our clear close contacts.
Patricia, I'm going to talk about the 4 pillars right now.
Yeah.
Because I've been saying that each of the 4 pillars has had like their golden moment in the sun over the last 9 months. And right now, the golden moment is for the physical distancing pillar. Because if you are based on the definition of a close contact, you have to be within 6 feet of someone to start with to be considered a close contact. So if you maintain that 6 feet or more all the time, the potential of you becoming a close contact are greatly minimized. And where this plays into a school site and the workplace is what I see is colleagues. We like each other, we want to connect, and we're right, if we're in person working in the office, it's easy to go kind of stand 2 or 3 feet away. You have a face covering on, but to chat, you might be indoors. And that is the kind of behavior that you really want to draw attention to your staff, that at all times, you should be really mindful of the 6 feet. And it's not always easy to stay 6 feet away from kids, but kids honestly aren't really transmitting the virus as much as adults are. So it's much more important for the adults who have the executive function to remember this thing about the 6 feet. And if you can say, no, I wasn't within 6 feet of these people ever, you're not going to be identified as a close contact. So yay for physical distancing, the pillar.
True that.
True that.
Okay, so now this is the piece that I kind of jumped ahead, that you're going to have to collect to give to San Mateo County Health about their name, their address, all those basic kinds of things, their date of birth, any other comments, and write all of these things down because you will be asked for that information. And when you get the address, the county is important, because if you report to San Mateo County Health, the person lives in Alameda County, then they're going to pass that on to Alameda County to do that outside the school contact tracing. So that's important information as well. They will often, but not always, it seems like from our experience, reach out to the person. So it's probably good to let them know that they may be getting a call from San Mateo County Health to get additional information for contact tracing for outside of the school site.
Patricia,
so then,
can I ask you bring a question to the discussion that's in the Q&A? It's a very specific question about if you have a positive case inside a classroom and the class is 70 minutes long or even 30 minutes long, right? It's more than 15 minutes. And but everyone is 6 feet apart and they're wearing masks. What are we recommending for that class if you have a case inside that classroom? Would they all be considered exposed or anyone at all if they're 6 feet apart?
So do you want to answer that, Nancy, or should I?
I don't want to answer it. That's why I'm bringing it to you guys.
That whole, so this is again layers, right? Layers of safety. So generally, if somebody in a cohort, even though we know they're wearing face coverings and they're 6 feet apart, if somebody in that cohort ends up becoming a case, that cohort goes home. And again, just being careful. What if they had their face covering down some point, or, we just don't really know, especially when it comes to a classroom with students. So we've just been in an abundance of caution, kind of that's why a cohort closes. They could have been following all the rules. They're all apart, but this is where you would see the spread, and doesn't mean we're not going to see spread, because we haven't seen it now. But if somebody was in a classroom, it's possible their face covering was down or whatever the issue is, you could potentially have spread. So everybody just goes home just to be careful. But we aren't, so my point was, we're not seeing cohorts where somebody had it and then another person had it and another person, not even clusters really. So it's kind of important. Again, it might feel like not a necessary step, but it's just an extra cautious step. And I don't know, Jill, if you wanted to comment on that. And
no, I agree. And I think that we can still give physical distancing its special day, because I think the cases that we have seen have been between staff members who let their guard down in terms of taking off their masks or getting too close. So yay, physical distancing.
That's the number one thing.
The superhero of the day.
That's right.
But if you're in a classroom, to that point, to Joan's point here with this question, even if people are 6 feet apart, we're in an overabundance of caution in order to really interrupt any chance of an outbreak in that classroom. Everybody goes home for 14 days and quarantines. So I just typed that in so that everybody can go back to that answer.
Thank you. So now we're going to discuss a little bit of the return to work process once you've spoken to the case and what they need to do. So this is going to vary a little bit based on if it's an employee or a student. So we'll try to cover that, but we can also address that in the chat and the Q&A or later on. So if the case has symptoms, they must self-isolate for 10 days from symptom onset. And that means staying away home and everything else we've talked about, self-isolation. So that's what they have to do. 10 days is the number. Seems strange that it's 10 days if you actually have COVID, but it's 14 days if you don't necessarily have COVID. But that's just how the virus spreads and works. You'll want to, of course, let the case know that people in their family and in their household are likely to be close contacts, and they probably should get tested and review the definition of a close contact. And if the case is initially asymptomatic, but they develop symptoms during that isolation period, they need to isolate from 10 days from when those symptoms appeared. So you got a test result back and they were totally asymptomatic and felt great. So they went home, they're 5 days in, and now they start to feel symptoms that are consistent with COVID. The 10 days now starts from when those symptoms appeared. And then if the case has no symptoms, at all, and it's a test result, then it's 10 days from the date of their positive test. And we talked about that already. It's from when the test was taken. And this is all in the pandemic recovery framework with a lot more detail and a lot of sort of ways that you can say if this, then that, and flowcharts and such. Once the self-isolation is complete And if the case still has symptoms, they must stay home until they're symptom-free for 24 hours. So when we started reviewing plans, and some of you may have plans that say 72 hours, that was the case. And then, I don't know, a couple months ago, it became 24. So it went for 10 days of isolation and 1 day, 24 hours symptom-free, as opposed to 3 days symptom-free. And the pandemic recovery framework reflects that change. It's important that the cases, whether it's a child or a staff member, communicate with HR or the school before returning to work or to school. Just check in and I'm feeling great, I've had no symptoms, whatever the situation is. The same check, and if they're not feeling well, they need to communicate that as well. If there's a change in the condition that might affect the return date, they need to let the school know that as well. And again, somebody needs to be tracking all of these different dates so we don't say like, wow, wasn't Tommy Jones supposed to be back in school? I haven't seen him for a month. So it's important that we keep track of that. Ask the case if they have any questions. Remove the case from the school district testing. So this has come up before, and this is important. If somebody has a positive test, then you're going to take them out of your testing for 90 days following their positive test. So the reason we do that is that somebody can still appear as positive 90 days after their first test. The other side of this is we're catching people right now. They may have had COVID 2 months ago and they're just getting tested now and we're finding out, but they were completely asymptomatic the whole time. So just so you know, this has come up. Keep the person out because then they freak out that they have a test and positive test. So according to I have a positive test, I should stay home. And then parents and guardians should contact the site principal before returning to school. So there's a lot of people keeping track of people in this. So we added this in here, and Jill and I use this. Jill in particular uses this a lot because she takes these questions. And this is in the pandemic recovery framework and it's other places. And it's just a great, like, okay, did the person have symptomatic? And then did they get tested or not tested? What do I do? So we just threw this in there. I won't go through it, but it is a helpful tool to use from San Mateo County Health. Okay, so after the case interview, you've completed it, that case is home and taking care of themselves, you're going to start reaching out to the close contacts. And you may want to discuss the situation of those in shared spaces and other possible situations that are not clear. So for example, that's your cohort of a classroom. So you might talk to, if you're not already clear, the principal and say, well, Susie Sunshine was in this classroom. I think we should close the cohort. And that's what you can do. So that's how you might look at shared spaces. If people are in an office together and it's 6 feet, but it might be tight, you might want to err on the side of caution and have those people self-quarantine. So you need to kind of figure out that. That's why there's a little bit of thinking maybe before you're finished with this process. And so reach out to your human resources, or if you have a district support person to kind of serve as a thought partner on how to proceed. The other key thing, as you can see is bolded, is call San Mateo County Health. Now what's going to happen probably is somebody's going to answer the phone and they are going to, well, actually, somebody may not answer the phone, or they may, and you are going to have to leave a message. And sometimes you may not hear back from people for 2-3 days. It used to be the same day, that was the next day, but as you can imagine, the pandemic and COVID is spiking. These folks are excellent, but they're also really busy responding to cases. So you'll want to notify them, but this is why knowing what to do is important. Don't wait to say, oh, we have a case, I better call San Mateo County Health and let them know. You need to start working on your contact tracing right away. That's your responsibility to kind of figure that out and start doing it. If San Mateo County Health will let you know if you need to do a line list, how often, like they might have you reporting back to them every day at 10 o'clock. That's all in the pandemic recovery framework, kind of a heads up on that. But they'll let you know what is needed. A line list is just where you kind of are tracking a possible close contacts in your school. But this is a thing I want to just say, if you have an urgent question, reach out to us at San Mateo County Office of Education, Jill or me, or let San Mateo County Health know when you call them. I have a really urgent question. I need to talk to someone as soon as possible. because they're thinking you're just calling to let them know there's a case and that you're already on top of it, because they're used to working with nurses, right? Nurses know how to do this stuff really well, and I'm really going to put a plug in for nurses doing this work. But if you are not really sure, or you have a question like, I don't really know, do I keep this person? I have gotten calls from people who said, I haven't heard back from San Mateo County Health and I was waiting to ask. So they still have close contacts in their school doing everything. And so it's really important that, one, you own it and you take action, and then follow up with San Mateo County Health. And if they tell you you really didn't need to close down the 5th grade because one classroom kid in 5th grade had COVID, you can then adjust and say, okay, well, we've changed our policy. Those other classes can come back. I think people have a little grace and flexibility, but if it's an urgent question, you really should get help right away. And then close contacts. So these are a little easier. These are people who will probably be a little mad sometimes. And so you just have to be aware of it. Often these people already know that because the person who was the case picked up the phone and called them. And so you may not be the first person to tell them, but you will let them know they've been identified as a close contact and define what a close contact is. Do not reveal who the case is. So you'll have to be careful. If it's somebody in a classroom, you'll have to say someone in the classroom, not necessarily the teacher, not necessarily the student. Explain the self-quarantine process, ask them to monitor their symptoms. And then if they need to, seek testing through their health care provider. And if they test negative, they still need to self-quarantine for 14 days. Seems obsessive, but that's still the policy because it could still show up later on. And if they test positive, then they're a case and we start this whole process all over again. So that's close contact. So they're pretty easy. The hardest thing is getting these people. So make sure people update their phone numbers and their contact information so you can reach them. And also do not email people that they are a close contact. I don't think that's a good approach. And you wouldn't leave this information necessarily on a voicemail. Just tell them that you are calling from the district or the school and you need to talk to them as soon as possible. And then some final steps through your contact tracing process. Send a notification to your school families, staff and families. Exposure notices to the case and close contacts per San Mateo County Health guidance. They have these forms that they give you just like as they would for the measles and things to send out to those people who are cases and close contacts, even though they already know. This is sort of like closing the loop on the notification process. Conduct any follow-up that San Mateo County Health asks you to do. Update that handy dandy internal tracking system to write down everything that's happened. Notify your district lead, your principal, whoever else in your chain of communication that you need to. And then you're going to notify San Mateo County Office of Education as well. And some people have said, why are we notifying you? I've already contacted San Mateo County Health. Well, there's a couple of good reasons. One, San Mateo County Health may not get you right away. And so if you wanted to get some questions answered, we can try to help you. We do have like Jill, who's fabulous here. And the other thing is we, and Nancy in particular, need to kind of have a sense of what's happening in our schools across the county. We need to know, like, wow, there's a lot happening in Belmont these days. And should we look into this a little bit more? Or we need to be able to say, when we tell people we're not really seeing spread or something in clusters in schools, we can't say that if we start seeing data that maybe reflects otherwise. So it's important, and we appreciate it if it's a quick call. You can just let us know. We don't need to know anybody's name or anything. We just need to know that you had a case and we're on it. And we let San Mateo County Health know, and there are no close contacts, and it was a student or whatever, and that's enough for us. And this is the contact tracing communication map. Again, it's very simple. You want to keep fewer people in it than more, because then the information is leaking out all over the place. Somebody thought you were doing it, and I thought you were doing, and who was going to call San Mateo County Health? Nobody did. So it's really important to have a system in place, and this is in the framework. And then some final words of support. Hang in there. It gets easier the more we do it. I definitely have some frequent callers. Somebody seems to call me almost every afternoon and gives me an update on what's going on. Keep the process simple and direct, and then encourage your staff to call the COVID point person first. I think you could probably also just give everybody at your school, particularly the school staff, like a one page or something on the COVID-19 process, so that when they get a call, they kind of get, okay, I got the call, so I knew that's what happens when I'm a close contact, and we can provide something like that. Don't use email; that is not secure. And update your contact information. And this is one that is pretty new, but Jill and I just had it confirmed with San Mateo County Health. Report cases to San Mateo County Health and SMCOE, even if the students or staff are not on campus. So if you have people who are testing positive and they've never even been on campus, that's information we're tracking as well. And that's that. Any questions? You can raise your hand, I guess, or put them in the
Patricia,
Q&A.
one important question I just answered was about the sort of the confidentiality of the notifications. So there is a new law going into effect January 1, where even if your case occurred at a specific school site where you normally would have just notified that community, now the notification has to go to your entire district community. And you will want to name the school just so that everybody doesn't like everyone have like hysterics at the same time. You can like limit the hysterics by naming the school. But if you, let's say you have a very small program or a very small school, you want to be much more careful about what you name, because what you don't want to do in your communication is give any additional clues to identifying who the individual is. And so you only give as much information as is important for the knowledge of the community and the confidentiality of the patient. And, everybody wants to kind of whisper and say, oh, I think I know who it is. But that kind of thing needs to be also addressed in your sort of school climate conversations, like through school newsletters and principal messages and superintendent messages, that we're all sharing the planet together during a time of a global pandemic, and every single one of us could potentially contact COVID. And so we need to really reach deep down into our empathy and compassion spaces and have the most amount of respect as we can for each other. So that doesn't just happen by itself, unfortunately. Human beings need to be led and taught, and we need to set expectations for the community. So you can do that in a variety of ways that you communicate in your school districts. And I would also turn that over as a task for, parent volunteer groups. Like, can they do a little kindness campaign or something like that if they want to help in some way? We do have a number of unanswered questions here, Patricia, so maybe we just take them sort of one at a time. And one or the other of us can type the answers while the rest discuss.
Do you want to take the questions, Nancy, and we'll help you if you need them, or Jill?
No,
or...
I'm happy. I'm an English teacher. I'll be happy to read the question out loud.
Okay.
And then you guys can answer them. And then I can type because I'm the reader and the writer. So if a person is a close contact, they said direct contact, but they mean close contact, should that person reach out and contact the district or school point person? If you know that you've been exposed to a case, should you reach out to the school point of contact and let them know?
Well, I think you need to let your HR person know, because you're not, this is a faculty member or, staff member, if you're a close contact, you need to reach out and let them know that you're in self quarantine, so you won't be on campus for whatever that 14-day period is. So you do need to notify someone. I don't know if it's like the principal of the school or whatever your communication flow is, but somebody needs to definitely be notified. But the contact tracer really doesn't need to be notified, because that's not impacting contact tracing. If you are close contact because your son was home from college and gave it to you, that's stay home and we hope you feel better.
Great. What if the close contact denies that they were within 6 feet and 15 minutes? Close contact deniers. It's a new term for 2020.
Well,
Jill.
Nancy,
Sorry.
this seems like the kind of question that Nancy would like to answer. And I think it would be something like, we can't really control people's personal behavior. I mean, we can only accept the information that they give us. And I don't think that there will be a lot of people who don't give us truthful information.
I don't know what their motivation would be for that, but I talked to somebody yesterday who said there was a child who was a close contact, a kid came to school and said, well, I'm a close contact because my dad has COVID or something. And they're like, oh, so they spent all this time trying to locate the parents. They called the parent. He said, I don't know what you're talking about. I'm not a case. Finally got a hold of the mom. She's like, oh, well, I'm still at work right now, but yes, my husband is a case. So now we've had a family who sent a kid to school who's a close contact, a dad who's lying about it, and the mom who's still going to work and she's a close contact. So yeah, that kind of thing does happen. So sadly.
So, but you do have still there is power in messaging and communication. And so that whole idea of a social contract, again, these are messages you can send out through your school newsletters. You can have conversations in your staff meetings. We're on one planet. It's a global pandemic. There's never been a time in my lifetime where my behavior impacts so many other people. And that's true for every single one of us. So we are more responsible to our communities than we've ever been before, because that's part of living through a pandemic. And so you're not going to be able to repair people's moral character. However, you can really create a climate and a culture of social responsibility, empathy, and compassion through your messaging.
Yes, and in this particular case, for example, some people are motivated not to tell the truth because they need to work and they need to go to, and I know from this case that that's probably the situation that those, from what they told me the parents did, they probably needed those jobs badly and were afraid. But there are a lot of resources from San Mateo County to assist people with isolation, with if it's a financial hardship, to help them out. So it would probably be good on the compassionate side to be aware of those, so you can let the families know that.
The other thing is we have, people don't have, like, I'm on the older end of the spectrum in my life cycle, which means my brain isn't as fresh as it used to be. So I don't always remember everything. And we've had circumstances where we did contact tracing with a case, and they said, I was with this person and this person. And so we contact those people and they say, I haven't been at school for 2 months. So that person might have been confusing that, yeah, we talked on a Zoom call, but we weren't like standing in the same room together. So yeah, just like everything else, we get to work with human beings who, keep us on our toes. And so we just have to do the best we can and use all of your skills as administrators to respond. So on a, I see another note about the link in the chat is not clickable, but oh, Siri can't help us with that right now, she says. But I put it into the, it's in the Q&A. Is it live? Is the link live in the Q&A? So, and if not, we'll send it. Yes, we will send it out after the fact. Right?
And they could probably select copy and paste it too if it doesn't click, but we'll send it out.
Okay. Here is another question. Do we use the contact tracing questionnaire for students or strictly employees? Good question.
That questionnaire was designed for staff. Students are a little bit different, right? Because the parents will notify you until you have testing in schools. That's much more prevalent. You're going to hear from a parent that the child is a case. And so the school is really going to have the information about, remember, we're just doing the contact tracing in the school. So if that child is on a bus, then we know that that child's on the bus, and then we know where that child's class is. And so we follow. So the parent would not be able to assist you with any of that kind of information. So probably that kind of questionnaire would be more useful to the people within your own school about where little Jill had, like what does Jill's day look like? How does she arrive? Maybe the parents could fill you in on that piece. And then how does her day progress?
I would add also that I think it's prudent to have some sort of tool for how you're going to, to get all the details from students. So maybe use that questionnaire and adapt it for students or something like that.
We're not quite as refined right now about what's going to be what's required for students. Just in general, you need to get, if they're if what classrooms they were in, and it's more about knowing their schedule, I think, is what you're saying, Patricia.
Yeah, so the schools that have had cases of students, they are very clear on where that kid has been during the day. Yeah. And so they don't really need to ask the parents too many things. The only thing is they will say, if they've been like at a sleepover with other kids in our school, it would be helpful to notify those parents.
Great. Okay, Roberta saying thanks, well done and super helpful. Thank you, Roberta, for all of your amazing leadership in Portola Valley. We love being your partner. Next question is, should the notification go out to the community if the student was not on campus at all?
So I think
they're in distance learning, basically.
And so if you're going to notify the whole community, well, what do you guys think? It's a tricky one because you have to worry about confidentiality. I think I saw a case where there was recently somebody who said that they had a case and the kid hasn't been on campus really. So you wouldn't want to really put that out because you're just narrowed down the number of kids who might not be on campus. So I think being aware of,
it's about transparency in your community. So if you want to share that there's a case, what really matters is who's on campus. Mm-hmm. So that would be your number one priority for notification. If you want to, if the district decides they're going to notify everyone for every case they get, which I think many districts aren't necessarily doing that because there's no impact on the school. But if you do, you would simply report that the student has not been on campus and there are no close contacts. Keep it really short. What frequency does the communication come out? For example, Monday we hear of a confirmed case, then hear about another on Thursday. So I'm not sure I understand the question, but every time you get a case, you should be notifying. And some districts have gotten multiple cases in one day. So they send out one communication at the end of the day and say, we're notifying you of 2 positive cases. Close contacts have been identified and communicated with, and there's no impact to the school program. Something like that. And that's on Monday, and then Thursday comes along and you have another case, then you have another notification. Hey, Leanne. Leanne's asking, so to clarify, we should report cases that present in our virtual academy. These individuals are never on campus and don't come into contact with any staff or students. And yeah, we're asking for that, the county offices, and you should be calling them into county health as well. Am I right about that, Patricia?
Jill just talked to Jeannie about this yesterday.
So Jill, you want to answer this one?
I'm sorry, I just had a call on the side. Could you repeat the question?
Yeah. So they schools should be reporting cases that present in the virtual academy for individuals never on campus and who don't come into contact with any staff or students. Did you discuss that yesterday with county health?
Oh, we're just talking about reporting students who have not been on campus?
Yeah, whether the school is calling them into county health or not.
Yeah, they want us to let them know any cases that we have. I thought we already answered that one.
Well, it might have just be worded differently, but yes,
Okay.
all cases reported to the school involving anybody in the school community should be called into communicable disease. And then we are asking people to report it to us at the county office. And then we're keeping a really lightweight spreadsheet, like student was in distance learning, no close contacts. That's it.
Right. I'm remembering, Patricia, now that particular communication, and it was, I guess that the thinking is that if you get tested outside, that maybe that whoever tested you would be sending that information to public health, but they would actually be appreciative if we would share that with them as well.
For them, it's a way of cross-referencing that this person is a school member, a school community member, and they're trying to keep data on how the schools are doing.
Right. Thank you.
Patricia, why don't you take a couple questions? I'm still trying to type my answers here.
Okay, let's see where we are.
Carrie D's is where we are next.
Carrie D's.
It's like from the top, it's about 3 down. That's okay, I can go ahead. So the question is, do you need confirmation with a doctor's note or just the information from the person who's impacted? In other words, how do you confirm? Do you need a doctor's note or do you just take their word for it?
I think that's a individual policy decision. I mean, if you're getting the information from your surveillance testing, of course you've got that. And then, I mean, again, I can't imagine that somebody would call and falsely report that they have that they're a positive case. But if your program, feels that you want to have that kind of tracking, I guess you could request that.
The one thing I would say is that you do need to ask questions to confirm that the person genuinely understands what it means. Because some people will say, I got my hair cut at 10 o'clock in the morning, and then later in the afternoon I got a notice from my salon that someone was in the building who was positive, and so I'm now a close contact, or I'm now this or that, and they don't always understand what it means to be a close contact. So number one, I think you always have to ask follow-up questions, and I think number two, based on the answers, you're going to get your answer. Like, that the person really did test, they have a date, they have a place and a time. But I think Asking for doctor's notes right now is really problematic because, as you can imagine, doctors are really busy. So that probably, if it was county health on the line, they'd probably say no. I'm channeling. Letice, oh, go ahead, Patricia.
Well, I was looking at the wrong computer, so I have the Q&A up here. So,
Okay, go for it.
well, I just noticed there are a couple of questions right in a row about a dashboard. Would that cover the notification requirement? I don't have an answer to that. And we'll
No.
have to check. I would think not.
No. Well, I'm going to say no, no, and no.
And should our dashboard differentiate cases that are on site and off site? You can certainly do that if you want to, but you just want to make sure that you're aware of the numbers. Again, if you had cases of students on campus and then cases of students off campus, and there's only a few kids on campus or a few kids off campus, you want to be aware of confidentiality issues. But you could break them up into those different ways. There's no reason you couldn't do that.
Okay. This is, I'm not as good a multitasker as on Friday afternoons. So Lisa says, I believe you answered this already, but would you confirm that when a school site has a positive confirmed case, the entire school district community is supposed to be informed, including the school name, not just that individual school site staff? And so the answer is yes, the community needs to be notified. And you don't have to name the school. It depends on the size of your community. But if you're talking about a whole district, I think it's helpful to name the school. What I would not do is name a classroom in a school, right? You're not going to go to that level. It's either school level or district level, and up to you guys. But and then Mark is saying, did I hear correctly that SMCOE wants the name of staff who tested but was not on campus? No, we don't need any names. We don't collect any names at all, number one. And number two, yes, we want to know if you have positive cases, whether it's a staff person, a parent who was on campus, a vendor who was on campus, or a student. So all we need to know is we have a case. They got their test results on this date. We've done our work. There's no close contacts. We called county health. And that's kind of what we do. Okay, would it be appropriate to ask if the student has been in contact with other students outside of school?
Yes.
Okay.
I think that it would be useful if you are, so you're going to get notified probably by a parent. And when you're talking to that parent, you can certainly ask them. But I don't know if you could ask the parent to follow up with those families and let them know.
But keep the questions focused only on students in the district. You don't want to get involved in asking questions about students from other schools. That's all county health's job to do. So you're only focused on your own school community. So Carolina says, just so I understand, if a student is in distance learning and has not been on campus and they get COVID, they need to report it to the school and we need to report it to the county health office. Yes. That is an easy answer. Mary says, I asked San Mateo County Health this very question and was told no. Well, that all depends on who you talk to. But we talk to them every day.
We have it in writing yesterday from a message that Jill sent to their head school nurse, I believe. So
our SMCOE practice is a yes to that question. And again, this is a human situation, so it's not perfect and it's not without gaps. So Joan is asking, in the case of a student who is positive, had not been on campus, but was around another student also not on campus, do we update the community about that? No, you're not. Your contact tracing protocol is about what you're doing on campus and how you're keeping the campus safe. What you would do in this case is you would report this to county health. You have a positive student. Looks like there may have been another student who was a close contact. School might want to reach out to that other family and make sure they're aware. And then you would not have to notify the community about that, about the other student, I think.
Right. We don't notify people about close contacts. Only if there's a case in a notification, you would say close contacts have been notified. Just the only thing tricky about reaching out to people saying, hey, I heard that your child was playing with this child in their case. Should we, are you aware of that? Handle that gently, I think. Because
Yeah.
a lot of people are like, why are you asking, or no, or
Yeah, I mean, you as a school community, you have to understand what kind of relationship you have with your parents and families. And you might just want to report the information to county health. Depends on your relationships. And Jones, oh yes, Jones saying, does this start on January 1, this communication out? Yes, it's the new OSHA requirements. And if you're in a public school, your school superintendents have all that information. So what if through the grapevine, we hear that there is a contact to a case in our district? Does this need to be investigated? So this is about rumor control right now. And especially when this all first started in January, February, March, everybody was tattletelling on each other. And in the most cases, it was basically gossip and rumor. So I'm going to say, Letitia, that you kind of have to use your spidey sense on this. Use your common sense about, is there someone you can call and ask questions that don't identify anybody. And the other thing is, typically, I think if our lawyer was on the call, she would say, no, grapevines are not confirmations and they are not positive tests. So every time you hear something through the grapevine, pour yourself a glass of wine and then keep going.
well, you can think how that would play out. Hi, Nancy, I heard that Jill was playing with Susie, who has COVID. Well, now you've just notified some people that a child has COVID. Or you say, was with a child outside of school. Well, the parent's going to want to say, which child? And so now you are really getting into a slippery slope confidentiality problem.
Yeah, I think that goes back to the idea that San Mateo County Health is in charge of things that occur really outside of school, and we focus on things that occur inside of school. And if we can help suss out the real truth of a story because we have a good relationship, or because they've even contacted us with that story, then we can help out and make sure that county health gets the correct story. But then they do that contact tracing.
Yeah. So here's a good question, or an interesting question, I should say, from Abby. Should our dashboard differentiate cases that are on site versus off site? Dashboards are a bit problematic to begin with. County health doesn't like them. They're not going to stop districts from doing them. And the county office is not ever going to do a dashboard on cases. So the only place that could happen is in your district. Some districts are doing it, that's fine. But my advice would be have a qualifier on your dashboard that says these numbers only apply to students who are on campus for in-person learning. Because some families who are distance learning, they may not pick up the phone and call you and let you know about their cases. It's much harder to count that data as accurate for anybody who's not on campus. But for anybody who is on campus, you pretty much have that wired down for all the different reasons that exist. And so I would put a qualifier on your dashboard that says the dashboard numbers are only for on campus and in-person learning. That's not what you have to do. That's just my suggestion. Okay, Lisa says, I believe you answered this. I think I already answered that. We already did that one. Okay. By school community, you mean students, faculty, staff, and not parents, right? No, we mean your school community. We mean your families. And when you send out a school communication to your community, it probably goes to the staff and the families. These are not staff notifications, these are community conversations. Who is impacted by the data, by the information that you have a positive case? It's your school community. So I know for some of you, we've already adapted our process to match the OSHA requirements coming January 1st. So we're already doing this. I realize now that some of you may be hearing about this for the first time. So you may be a little bit freaking out, but it's okay. It's just, you'll just start to change the way you do it. And you can also preface it with a short paragraph about, based on this new legislation, we're now messaging out to the entire school community when we have a positive case. So you can expect more notifications. Kelly's saying, can you please confirm that all close contacts in a class cohort should be called and not emailed? Who can make these phone calls?
Okay, well, it changed to Nancy's typing, but I think that when I've talked to schools, they have made those phone calls because they wanted to make sure that they connected with someone. However, I mean, I suppose you can. I don't know, Jill, if you have a thought on this from just how things are reported, because those would be exposure notices for the most part, what the process is.
So I think that calling people, we talked about that, you make sure that you contact them and you get the information that you need. Typically, exposure notices in schools are mailed to people's homes. Sometimes they're sent home with students who are in class at the time.
I think there's a definition problem with this question, Jill.
Oh.
Because when we talked about a class that's 6 feet apart and they sit in class all day long, and there's a case inside that classroom, we don't necessarily call all those kids close contacts.
Right.
We just, in an overabundance of caution, we are quarantining them to stop a further spread in the school. But a close contact, if you're going to use that term, is someone who's been within 6 feet of another person for more than 15 minutes. And that would be a contact tracing process. So I'm sorry I interrupted you, but.
No, I think that was what I was going to say. It's the contact tracer who would make the appropriate calls.
If needed, if they are actually
Maybe.
close contacts. But again,
Right,
we're
if the classroom is, if they're in session and there are kids who are close contacts.
And if an exposure notice is a much more just generic notification, like 3 or 4 lines long, right? It's not expected to be a two-way communication.
Right.
Okay, so we have a few more minutes here. In terms of notifying districts of a positive case, is this also for the case for a private school? Yeah, are you talking about notifying the county office of ed? Um, if
You
you're
wanna-
talking about notifying the county of the communication protocol is every school, public or private, if they have a case, they call San Mateo County Health, communicable disease, and report it. And then they notify the county office of education. Is that right, Patricia?
right.
Yeah.
So public or private charter, they will all do that. However, if you're a private school, you don't have to report this to the public school district in your area,
No.
if that's what that meant.
Okay. And can a school principal or nurses help with phone calling in addition to the COVID lead? Because it can take hours to call families.
Yes.
Yeah, I say whoever your team is, you should all work together to get all your contact done and all your information disseminated.
You need a team, you need the point person, because sometimes that person's not going to be available. So number 2 on that list needs to be ready to jump in, number 3. And then if it becomes pretty expansive, well, you've got that team that all kind of knows what they're doing, hopefully at least 3 deep, and they'll do the work.
And then one more, is there a form template that the parents can fill out to report a case, or are they supposed to call or email the COVID contact person? So is that a local decision?
I think it is. I think it's probably good to get a phone call because there will be questions. So if somebody really feels that they're going to report something, you have to talk to them anyway. So
If you want to have a form as a backup, some families may not feel comfortable calling.
right, it could be on the website. But you'll probably have to do a follow-up phone call anyway.
Okay, so oh, we still have 11 open questions. Well, we're kind of out of time right now, aren't we?
Well,
Or
some of these
maybe
we
it's
opened,
because I haven't like been able to answer all these questions and send them. So
I
we
think
don't.
we've answered these, Nancy, most of
Okay,
them.
yay us. Can you guide us or share a link to the OSHA guidance? And we will send out a link once we figure out where it is. Okay, we'll send out a link once we know.
And we can also put the link back into this folder that Jill created. So if you want to go back to this and find resources, we will try to keep it up to date with new information as we receive it and then update things as we get them.
Okay, so wow, you guys are amazing. Thanks for sticking it out here. For being here on a Friday afternoon, and we're going to sign off now. I'm going to stay open for just a minute because we do have a couple more. We'll go back and fill in the questions that we weren't able to complete, and that'll just take a minute. But everybody have a great, safe weekend. Happy holidays, and thanks for joining us today.